Hi, I'm doing this video because there's a lot of controversy about whether or not Kate's diagnosis is true. Well, we don't even know what type of cancer Kate has, so everything is guesswork and no definitive statements can be made about the cancer. Everything is just a guess. And that's important because what type of cancer you have, where it's located, and how much it's spread, how big is the cancer, all are very important in trying to make estimates of, you know, how much she knew about the probability of cancer before she had surgery, and her survival chances, her chances of doing well with chemotherapy, and so forth. We don't know the type of cancer Kate has. So everything is a guess. And if you ask oncologists their opinion, the oncologists will differ. Just like people, everybody has an opinion and they will be giving it out freely, and it doesn't really make that much of a difference because nobody knows what type of cancer Kate has. That is very, very important. But this was put on the internet as one oncologist giving his report or feelings about Kate's cancer. And I'm going to play this, but again, I want to let you know this is not Kate's doctor. He does not know anything more about Kate's illness than you and I do. He does, unless they revealed it at a meeting, which I'm sure they did not, but he does not know anything about where her cancer was located, how long she had been having symptoms, what was the size of the tumor. Now, they will do tests before you go in for surgery. You don't just rush in for surgery unless you're having a life-threatening problem. And maybe she did. I don't know what happened to her. Maybe she was bleeding out. But usually you don't go rushing in for surgery. You have all kinds of tests beforehand, and they can usually see on various tests, the CT scan or MRI, where the tumor is located, and they can tell the size of the tumor. Now, sometimes they can't tell whether or not it's cancer until they actually get a piece of the tumor and have it looked at by a pathologist. This will usually be done during surgery if it's deep into the abdomen. So they'll open up, they'll take a specimen, if possible, have it read by a pathologist during the surgery. And they want to do this because they want to look for lymph nodes. Where did this tumor possibly spread? And is there a need to go and take out some lymph nodes to see how far the tumor has spread? Of course, if they detect the cancer during surgery, that's an immediate diagnosis. So you would know immediately upon waking up from the anesthesia that you have cancer and that you had some lymph nodes taken out to see whether or not they're positive or negative. If they take something out, they think it's a benign tumor, and they take it to the pathologist, and he later finds out that it's cancer, well, then they might have to go and do a second surgery to look for lymph nodes. Now, this would be less likely, one, because she's a very visible person. They're not going to want to flub up on this surgery. They're not going to want to have her do multiple surgeries. At her age range, depending on where the tumor was, how big it was, and so forth. As I said, we don't know what this tumor is. They're still being very secretive. And so I think the suspicion is extremely high that they knew that they were probably dealing with a cancer. A benign tumor tends to look different than a cancerous tumor. So I think just by looking at the appearance of the tumor, they would probably have, and the blood and the vasculature of the tumor, they would have a very good suspicion as to whether or not the tumor was cancerous. So a lot of the story doesn't make sense, but I'm going to have this doctor play his bit and you can listen. Let me see if I can get that to work. It doesn't want to turn on. I'll play it later when I get this thing to work. But the other thing I want to say is you cannot be too dependent on our technology. I have known people who have had complaints about the breast. Self-knowledge of your body is one of the best things you can take to the doctor and go in and advocate for yourself. So I've known people who felt they had a breast cancer just by the way their body felt. And they went in, they had the mammogram. Mammogram showed something not too suspicious, but questionable. So they went back for a diagnostic mammogram. That takes about a couple months to get. That would say, still something questionable, nothing definitive, and then they say come back in a year. Well, the person felt that that wasn't right, and so they pushed on. They went and talked to two other doctors, both of whom helped get a referral to a surgeon. Now we're talking about another 2 to 3 months a delay, and then the person went and got another mammogram, another diagnostic mammogram from a very skilled mammogram service, only does mammograms, and they said, ordinary lumps, no big deal, come back in a year. Person still didn't feel correct. So they got a referral from a regular doctor to see a surgeon. Okay, because the mammogram people did not want to refer to surgery. The surgeon then, after urging, because the surgeon did not feel there was any need for surgery, after urging, the surgeon sent for a ultrasound and a biopsy and an MRI. They came back from the biopsy that there was cancer, early cancer, invasive cancer. The patient insisted she have a mastectomy. The surgeon only wanted to take out a piece, a lump. The patient insisted on a mastectomy for the pathology that was found, invasive cancer, and then they also checked for lymph nodes. During the surgery, they took out a lymph node after the pathology showed there was no cancer in the lymph node, and they took off the breast. The result is that the patient will not have to have chemotherapy, and there is very little chance that she will have any residual cancer in her body. So this is after a lot of tests, a lot of urging, and mostly advocating for yourself. So even though you have people who are years and years of experience with cancer, you might not be getting the best advice, you might not be getting the best treatment, you might not be getting the right treatment, and you have to know your body and you have to advocate for yourself. See if this is going to work now. Still not working.
Intestine, for instance, that goes directly to the pathology lab, often during the surgery. And sometimes whether something is cancer or not will dictate the extent of the actual operation. So it's very likely that the surgical team knew or had a good sense of what this was going to be prior to surgery, and that was confirmed at the time of pathologic testing during the operation. So this is something that would have at least been suspected before and confirmed during the operation.
So what they're saying is that they don't have a lot of stuff that comes into young people that are benign. I mean, there are a lot of benign tumors in the breast, when you are at the age where you are reproductive age. But as you get older, past reproductive age, Kate is in her mid to late 40s, so she is at the age where you're going to start seeing cancers come up. And everything is suspicious, especially when you're dealing with a royal. So I would say that they knew, high suspicion that Kate's tumor was cancerous. They probably found out during the surgery that it was cancerous because they want to know, do they have to go for lymph nodes? Do they have to do further tests? Do they have to get a CT scan of the head to see whether or not she had it spread to her brain? Or did it go to her liver or other things? A CT scan of the liver and all kinds of other tests that they need to know if you're found to have cancer. So we are not getting the full facts. We do not know what's happening. We don't know the initial surgery. We don't know the full initial diagnosis. We don't know whether or not it's spread. We don't know anything about her chemotherapy. We're being shown all these pictures of her happily shopping and carrying shopping bags, walking through the forest with William and so forth. But none of this is making sense, because if you're able to do all of this stuff, you can easily come on camera in a clear video. Now, the video they showed us was looked like she was foggy. She was sitting on a bench with an old shirt that she's worn before, and said that she had cancer, but there was no need to give us a grainy video. Give us a clear video or even a live shot of her sitting in a chair with William and the kids, and saying, hey, I'm doing fine. Things are going great. I'm feeling fine. I just want to show you that I'm here and we're doing okay, and I'm being cared for by my doctors. Have a great day. And she should have done this before, not that grainy video that she showed us, which left a lot of questions, and not that story that they found out, like a month after that she had cancer. That doesn't sound correct. They would have found out during the surgery when they took a biopsy of the tumor. They would have done an initial screening of the tumor and decided whether or not it was or was not cancer. And if they found out later, say they took out a piece, they did a biopsy, there was no cancer in the piece that they took out, which is very unlikely because you can usually feel a cancer, so the areas which are suspicious to biopsy. But if they missed it by some freak chance and they did find it later, they would have found it within about 2 weeks. That's how long it takes to do staining of the whole biopsy and to see whether or not there are any cells that are indicative of cancer. So the whole story doesn't make sense. The pictures they're showing of Kate and William don't make sense. And in my opinion, you got to go with the story, because we don't know initially what's going on anyway. And for us, it's just a guess. We're outsiders, and but we do feel like they're hiding a lot, and we don't know the story. So, and we haven't seen the kids outside. So what's going on? They're so eager to get Harry's kids to England, but we haven't seen William and Kate's kids. So what's going on? We'd like to know, but we won't know because there's so many lies over there, and the media is so restricted. They all are given their talking points every day. And I'm going to talk about that in a few minutes in another video, because things are really weird in England. And I advise Harry and Meghan to stay away. Things are very weird. They will have to go there for the Invictus ceremony. I believe it's in May. But otherwise, don't bring the kids. And we'll talk about that in another video. Okay. Love you. Like and subscribe. Bye.